Next speaker is Dr. AYUSHI SARDANA, who's presenting on correlation of OCT biomarker, PROS, and CMT in diabetic macular edema, a tertiary care hospital study.
Dr. AYUSHI, I think you are aware that you are not ratified still. You are not a ratified member, so you will not be considered for the marking. Okay.
Good morning. Good morning, everybody. I am Dr. AYUSHI. I am presenting on correlation of prognostic OCT biomarker PROS, that is photoreceptor outer segment length, and central macular thickness in diabetic macular edema. Diabetic macular edema, as we know, is the most important complication of diabetic retinopathy. Optical coherence tomography is a non-invasive, non-contact imaging method and has gained immense popularity and importance. Analysis of qualitative and quantitative data from OCT can bring about significant changes in the management of diabetic macular edema. The inclusion criteria that we took were adult patients of both sexes and patients diagnosed with macular edema on screening patients of diabetes. The exclusion criteria was that we excluded patients of all other ocular diseases and of advanced media opacities. Any prior history of ocular trauma or surgery were excluded. It was a prospective interventional study done at RAO Prayagraj for a period of 1 year, and 50 eyes of 46 patients were taken. Our aim was to assess correlation between novel OCT biomarker PROS, that is photoreceptor outer segment length, and correlate it with central macular thickness and with best corrected visual acuity in diabetic macular edema that was treated with intravitreal anti-VEGF. After explaining the procedures, written informed consent was taken and all systemic history was done, and routine ophthalmic examination was done, including visual acuity, slit lamp examination, tonometry, fundus, and OCT imaging that was done with SDOCT using OCT macula 3D wide 12 by 9 mm scans. Now the measurement of photoreceptor outer segment length was done as we can see in this picture. A perpendicular was drawn from the center of fovea to the retinal pigment epithelium, that is the most hyperreflective outer layer, and 500 micron on either side of the perpendicular was taken to delineate the 1 mm central area. Now from the inner border of RP up to the inner border of IS-OS junction, we measured the photoreceptor outer segment length. So in this patient first, the pre-injection PROS was 16 micron, and we evaluated the patients at 4, 8 and 12 weeks, and repeated doses of Prorineta intravitreal ranibizumab was given when we found that CMT remained above 275 microns. So in this pre-injection was 16 micron. At 12 weeks, we found it increased to 30 micron. The second patient pre-injection PROS was 20 microns, and at 12 weeks, it was 27 microns. I hope you can see the vertical length of the photoreceptor outer segment length that I have delineated here. Patient 3 pre-injection photoreceptor outer segment length was 20 micron, and at 12 weeks after injection was 27 microns. So the pre-injection photoreceptor outer segment length was correlated with the mean CMT and mean logMAR BCVA at 12 weeks, and we found a negative correlation for both of these, which was statistically significant for central macular thickness but not so for mean logMAR BCVA. We also found that the mean length of PROS gradually increased from pre-injection up to 12 weeks, but the increase between the pre-injection and the 12 weeks was not statistically significant. Our findings are consistent with those of Abdullah Okuzaya and Corina Iluena Suiso, who found that shorter PROS in diabetic retinopathy or diabetic macular edema was significantly associated with worse visual acuity in patients of diabetic macular edema. Also, Yuki Mori et al. Hypothesized that mitochondrial dysfunction in the foveal photoreceptors leads to reduced visual acuity in diabetic macular edema. In this study, we used an advanced OCT machine that is Topcon OCT Maestro 2 with inbuilt ImageNet 6 capture software that allowed for very fine manual measurements. Conclusion: photoreceptor outer segment length, that is PROS biomarker, can be utilized as a quantitative OCT biomarker to prognosticate and predict the post-treatment visual acuity and central macular thickness in diabetic macular edema at first patient's visit itself before intervention. Although its measurement may be limited by presence of sensory neurodetachment and hard exudates at the fovea. Therefore, better automated ways may be required with more sample size for a better accuracy. These were my references. Thank you.